Hi there viewers, in this video, we talk about warning signs and symptoms of high blood sugar, and how they may affect your life. You might believe it would be obvious if you had high blood sugar, but signs of high blood sugar can fly under the radar. There are a lot of people who don't realize they have high blood sugar, so if this is the case for you, you indeed aren't alone. Diabetes is a serious, yet common medical condition. If you have diabetes, you need to regulate your blood sugars and regularly monitor them to be sure they are within their target range. There are two types of diabetes, including type 1 and type 2 diabetes. They differ based on what causes them. Diabetes is when blood sugar levels are too high because insulin is not present, or the body is not responding to the insulin that is present. It is also known as hyperglycemia. Someone who has been diagnosed with diabetes will be familiar with how it feels to have hyperglycemia. But for the millions of people who have diabetes or prediabetes and are unaware of it, knowing the signs of high blood sugar could prompt them to seek care and get a diagnosis as soon as possible. A person may have sudden symptoms of diabetes, or a diagnosis may surprise him because the symptoms have been gradual over many months or years. Number 1. Frequent urination. Excessive and frequent urination is known as polyuria. It occurs when blood sugar levels are high. The kidneys try to remove the excess sugar by filtering it out of the blood. This can lead to a person needing to urinate more frequently, especially at night. Frequent urination causes you to become dehydrated and get dizzy. Number 2. Increased thirst. The frequent urination that is necessary to remove excess sugar from the blood can result in the body losing additional water over time. This can cause dehydration and lead to a person feeling more thirsty than usual. The person feels excessive thirst and needs to drink more water than normal. Number 3. Frequent feeling of hunger. Many people with uncontrolled high blood sugar find that they're hungrier than usual. It is known as polyphagia. Constant hunger or thirst can be early signs of type 2 diabetes. People with diabetes often do not get adequate energy from the food they eat. The digestive system breaks food down into a simple sugar called glucose, which the body uses as fuel. In people with diabetes, not enough of this glucose moves from the bloodstream into the body's cells. As a result, people with type 2 diabetes often feel constantly hungry, regardless of how recently they have eaten. Number 4. Tiredness and fatigue. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar. Type 2 diabetes can impact a person's energy levels and cause them to feel fatigued when the body is not processing insulin properly, or it doesn't have substantial amounts of insulin. The sugar is staying in the blood rather than getting into cells to be used for energy. This results in excessive tiredness and fatigue. Number 5. Blurring of vision. An excess of sugar in the blood can damage the tiny blood vessels in the eyes, which can cause blurry vision. This blurry vision can occur in one or both of the eyes. High blood sugar levels can also cause swollen, inflamed lenses from fluid leakage in your eyes. This changes the shape of the lens, which makes it unable to properly focus, causing blurred vision. If a person with diabetes goes without treatment, the damage to these blood vessels and lenses can become more severe, and permanent vision loss may eventually occur. Number 6. Difficulty in the healing of wounds. High levels of sugar in the blood can damage the body's nerves and blood vessels, especially in the lower legs and feet, which can impair blood circulation. As a result, even small cuts and wounds may take weeks or months to heal. Slow wound healing also increases the risk of infection. Even minor wounds are more prone to infections, which can become very serious and even result in amputations of the foot. Number 7. Tingling, numbness, or pain in the hands or feet. Uncontrolled high blood sugar levels can cause nerve damage. This condition is known as diabetic neuropathy. High blood sugar levels can affect blood circulation and damage the body's nerves. In people with type 2 diabetes, this can lead to pain or a sensation of tingling or numbness in the hands and feet. Though neuropathy is most common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. It can worsen over time and lead to more serious complications if a person does not get treatment for their diabetes. Number 8. Patches of dark skin. Patches of dark skin forming on the creases of the neck, armpit, or groin can also signify a higher risk of diabetes. These patches may feel very soft and velvety. This skin condition is known as acanthosis nigricans. This can be a sign of insulin resistance. Blisters, infections, dryness, itchiness, discoloration, and abnormalities of the skin can all be warning signs of high blood sugar. Number 9. High risk of yeast infections. Excess sugar in the blood and urine provides food for yeast, which can lead to infection. Yeast infections tend to occur on warm, moist areas of the skin, such as the mouth, genital areas, and armpits. The affected areas are usually itchy, which is the commonest symptom, but a person may also experience burning, redness, and soreness. Number 10. Swollen or bleeding gums. Gum disease is a complication of diabetes. It can also make diabetes harder to control, because the body's response to infection is to release more glucose into the bloodstream, which may result in an increased risk of infection. Saliva contains glucose, and the more it contains, the more there is to feed the bacteria that combine with food in your mouth to form plaque and cause gum disease. Symptoms can include red or inflamed gums at first. They can progress to periodontitis, which can cause your gums to pull away from your teeth. There are chances of pus, ulcers, or even tooth loss may occur. Diabetes can be treated in several ways. Diet, physical activity, and careful monitoring are important if you have diabetes, no matter which type of diabetes you have. If you have type 1 diabetes, you will need to take insulin. That's because your body doesn't produce insulin. If you have type 2 diabetes, it may be possible to control your condition with lifestyle changes, such as diet and exercise. You may also need to take oral or injectable medications of insulin to manage your blood sugar levels. If you have diabetes, you will need to carefully track your diet to prevent blood sugar levels from getting too high. This generally means watching carbohydrate intake, as well as limiting over-processed low-fiber foods. Thanks for watching the video, and do like and subscribe to our channel.